everyone, I'm Dr. Nani, consultant breast and endocrine surgeon. So in conjunction with the Breast Cancer Awareness Month this year, we would like to highlight the importance of genetic contribution in the development of breast cancer and its treatment. Genes are a sequence of DNA that contains the code that make up or tell the cells in our body what proteins to produce. So it also gives rise to the physical characteristics that we have. So there are two copies of genes of each gene in our body, and they are located at specific areas in the chromosome. The two copies come from the father and the mother. So depending on the function of the gene, any defect in this gene can give rise to important proteins not being produced or give rise to the false or lack of proteins in our body. BRCA genes are actually breast cancer genes. So the word BR, the letter BR, comes from the word breast, and the next two letters C and A comes from the word cancer. So what does these genes do? They help repair damaged DNA. So there are two types of BRCA genes in human. BRCA1, which is located at chromosome 17, and also BRCA2, which is located at chromosome 13. So we know the function of these genes are to help repair damaged DNA. So what happens if the genes are mutated? So this damaged DNA could not be repaired, and this can give rise to the presence of cancer, namely breast cancer, and also other types of cancers that are associated with the BRCA genes, like prostate cancer or even pancreatic cancer. The BRCA testing is recommended for breast cancer patients who are diagnosed at the age of 45 or younger than that. There is this specific type of breast cancer which we call triple negative breast cancer. This is an aggressive type of breast cancer which usually occur in young adults. So in this type of breast cancer, if the patient is even at 60 or younger age, can actually test for the BRCA genes mutation. Apart from those mentioned, we also would recommend BRCA testing in those patients who has got close family relatives with breast cancer, maybe one diagnosed with less than 50 years old. Apart from that, patients with bilateral breast cancer, positive ovarian cancer at any age, and also male breast cancer are also recommended to have the BRCA genes tested. So what about individuals who do not have breast cancer? They may come forward to have the genes tested if they have close family relative with a known BRCA1 or 2 mutations already proven. In this scenario, the answer is no, but you have a higher lifetime risk of developing breast cancer. It can be as high as 85% for breast cancer and 40 to 50% for ovarian cancer. In this case, the answer is yes, because there are other types apart from BRCA1 or BRCA2 genes that are responsible for breast cancer, but the risk is highest if the BRCA1 or 2 are mutated. Yes, certainly. Regular screening as early as 10 years earlier than the index case would be recommended. For example, in a mother who has been diagnosed with breast cancer at the age of 40, the daughter is recommended to have screening starting at the age of as early as 30. In these instances, we would recommend a regular MRI of the breast if the patient is less than 40 years old. But once the patient touches 40 years old, then the usual mammogram with complementary ultrasound can be performed. Other methods that we can use to reduce the risk of these patients of developing breast cancer is what we call chemoprevention. In these patients, The physicians will prescribe tamoxifen to reduce the risk of developing breast cancer. With the increasing number of breast cancer diagnosed in young adults nowadays, understanding your risk is very important. With this, we can make early diagnosis and also institute early treatment to improve the outcome of breast cancer management. No one should face breast cancer alone.